Hey everybody, this is Professor Beth RN from nursing.com, and in this video, we're going to compare LPNs to RNs, including education, duties or scope of practice, pay, and career advancement so that we can help you choose your ideal nursing program. Now, keep in mind that both types of nurses are so important to the healthcare system, especially when frontline worker numbers have dwindled with the pandemic. We need all hands on deck in the nursing hustle, whether you decide to become an RN or an LPN. So let's get started. So what are the differences between an LPN and an RN when it comes to education? Let's compare diploma versus degree, how much time we have to actually go to school, can we pay ourselves versus do we have to take a loan or a grant? And what are we looking to learn? Is there maybe a specialty we're interested in? So an LPN, their degree is going to be a diploma. And a diploma takes way less time to complete. The length I've seen in these programs are as short as 9 months all the way up to 2 years. Program costs can be anywhere from about $7,000 all the way up to $40,000. So please shop around when looking at an LPN program because a bachelor's degree can start at $35,000. Curriculum, an LPN program is going to focus on doing versus thinking. Okay, hear me out on this one. Every nurse is a critical thinker, but the RN will delegate several tasks that the LPN can do. Wound care, medication, NG tube feedings, trach care. If you love skills, if you are a doer and want to get on the floor quickly, LPN is for you. RN, there's a few options here. We can get our associate degree in nursing versus our bachelor's degree in nursing. Program length for an ADN is about 2 years versus 4 years for a traditional bachelor's program. Now, program cost is going to vary. So try not to pick an ADN program more than $15,000 and be aware your BSN can start at $35,000 and go all the way up to $100,000. Now, when it comes to ADN or BSN, we're going to be doing and thinking, but hear me out. We're going to be having the LPN do all those tasks for us because they're amazing thinkers, while the RN may have more time for complex thinking for acute care or critical patients, like predicting outcomes or anticipating complications. As a future LPN or RN, you're going to have a ton of duties, and all of those are going to fall under your state's Nursing Practice Act. So after this video, feel free to Google your state's Nursing Practice Act for the details that will matter to you most. Now, these scope of practices are tasks that you're legally allowed to do while caring for patients, and it's going to vary greatly by state. Now, even though an RN will always have a greater scope than an LPN, we do see greater differences for the LPN. For example, let's compare Colorado and Ohio. Both states employ a ton of LPNs, and you can see that a newly graduated Colorado LPN can push IV medications into a central line versus in Ohio, where LPNs are pushing saline into peripheral IVs. Now, these privileges change with certifications you can earn after your initial license or on-the-job training. Let's compare independence, nurse-to-patient ratio, and patient acuity. So as I mentioned earlier, the LPN is a team member that will be reporting to the RN. Now, LPNs are going to have a higher nurse-to-patient ratio, and we can actually see a ratio of 1 nurse to up to 30 patients in places like nursing homes. But the great news is that you'll have a team of nursing assistants that you are delegating skills to. Patient acuity, your patients that will be assigned to you should be chronically ill. Now, that doesn't mean they can't go south and trend worse, but we're thinking more of a COPD exacerbation versus a patient who just returned from open heart surgery. Now, as LPNs, we're going to have a broader scope of practice, and we're also going to report to the physician. Now, our nurse-to-patient ratio can be as low as 1 nurse to 1 patient, much like that open heart surgery example I used earlier. And our acuity, we're going to have critically ill patients. Okay, these are patients that maybe even need to have a flight nurse take them right? So very, very sick people. The best place to get an accurate salary estimate is going to be the U.S. Bureau of Labor Statistics, and you can find them at www.bls.gov. Now, keep in mind that these pay differences are a national average. So this means that your hourly pay can look lower or higher depending on where you live. A great example is California. LPNs make $65,000 a year. Now, the BLS.gov just updated their information for 2021, and both LPNs and RNs are winners in several areas. Over the next 10 years, both types of nurses will have a projected increase of need of 6%, which might sound small, but it's way higher and faster than most other professions. So hello, job security. Now, if you're choosing LPN versus RN for pay, there is a difference. So your income is traditionally always going to be higher for the RN because of scope of practice and responsibility, but both are attractive. An LPN national average, hourly, they'll make about $23 an hour, which is around $40,000 a year, versus the RN, who makes somewhere around $37 an hour, and that's somewhere around $77,000 a year. Career advancement. So when considering the nursing career path that you choose, it's important to ask yourself a few questions. So is there an environment that you want to work in, such as hospital versus doctor's office is just one example? Is there a specialty or patient population you'd like to work with, like transient or homeless populations versus cardiac care? Or do you think you're the personality type that will want to advance to leadership? And your BSN is going to be the quickest route there. When talking about advancement, I would be remiss not to mention that LPNs have more autonomy at certain facilities versus others. You see, RNs, they can advance at any facility much easier. Whereas the LPN, it has a hard time advancing in an acute care hospital. Furthermore, populations can change this. For instance, a highly rural state like New Mexico has tons of opportunities for LPNs due to a bigger nursing shortage. So just to review, your education will have varying factors. So consider your time, monetary funds, your interest before you pick LPN versus RN. Also, your scope of practice or nursing duties. Research your state's Practice Act. That'll help you know what you're able to do, especially as an LPN, depending on where you live. Now, pay is attractive either way. And remember, if you have to take out loans, that'll affect your overall income in the future while you pay them back. And then advancement, if you want to get into leadership, education, or even work as a nurse practitioner, go with BSN if you can afford it. As you guys can see, there are so many factors when trying to choose what kind of nursing program you want to go to. From my own personal experience, my best advice is to consider your own personal needs rather than what you think others may want you to choose. Because either way, LPN, RN, your love for other human beings and patient care is needed for both types of nursing. You're both important key players in the healthcare system. I hope this information and advice help you think about your decisions today, and I'm so glad that you stopped by. After you enroll in nursing school, visit me at nursing.com. We have tons of resources to help you be a successful nursing student. And as always, happy nursing.